In this video, I'm going to talk about how many hours you might work per week as a PA or a physician assistant. How many hours is it typical to work per week? So here's the biggest kind of branch point. The amount of hours you work depends a lot on what specialty you work in. And then it kind of breaks down from there. But that's the biggest single question, is what specialty are you talking about? So I'm going to go through a few different specialties and give you some examples and some ways to look at it. But then it's always going to vary from, one situation to another. All right. And this is based on my experience as a PA. I've worked in 3 specialties, and then I've, talked to a lot of people or rotated through other specialties and so forth during my education and so forth. All right. So first of all, how many hours might you work per week if you work in the emergency room, if you do emergency medicine as your specialty? Well, the thing about emergency medicine is you don't just have like a Monday through Friday schedule, right? The way people are like, oh, well, what days of the week do you work? That's just like the typical question when people ask like about my work schedule. They kind of assume it's like, oh, Monday, Tuesday, Wednesday, Thursday, or something. Even like the ER nurses that I work with kind of assume it's like the same days every week at first, sometimes. But anyway, it's not a Monday through Friday schedule like a typical job, right? And that's because, of course, the ER is open on nights, weekends, holidays. So somebody has to cover all those different shifts. And typically, if you're an ER provider, like a PA or a doctor, then your schedule is not the same every week. It's not the same every month. So it's kind of a jigsaw puzzle that they put together every month to kind of figure out who's going to cover which days, which nights, which weekends, which whatever. So you don't work the same number of hours every week. You might work 5 days one week and 0 days the next week, or 6 days one week and 1 day the next week, or 2 days one week and 3 days the next week, and so on. So you don't work the same every week. But how many hours do you work overall or on average or something? Well, as you can imagine, if you're kind of doing some nights and some days and some whatever, it's a little bit more demanding on your body. And so if you were to do 40 hours mixing in night shifts and day shifts and so forth, that would be like doing 60 hours for a normal person, because you have to adjust and you have all the jet lag and stuff. So it's pretty typical for a full-time PA in the ER to work probably about 30 or 35 hours a week on average. But again, that's going to feel like 40 or more hours because you're having to adjust to different schedules and all that. And you have the inconvenience of working weekends and so forth. So that's kind of the ER thing. So full-time is a little less, but it's actually probably more physically demanding for those reasons. What about urgent care? How does urgent care compare to the ER? Well, some similarities and some differences. Depending on what urgent care you're talking about, it may or may not be open on the weekend. It's probably open on the weekends, at least part of the day, but it's often not open during the night. Most of them are not open nights, and it may or may not be open on holidays, right? So overall, you just don't have to worry about nights, weekends, and holidays as much in the ER, in urgent care as you do in the ER. So it's similar to ER, except you don't have as much jet lag, as much flipping from day to night and all those things. And so you're more likely to do like the normal-ish, 40-ish hours a week in urgent care. So kind of a typical normal-ish thing there. What about family practice? So I did family practice for a while, got some experience with that. And what I noticed is that is kind of Monday through Friday, 9 to 5, basically, or 8 to 5, give or take a little. So it's kind of the 40-hour normal hours. And so you do your work. But there's one big caveat. With family practice, you're more likely to have to take it home with you. You're more likely to have to do some kind of charting or something after you go home. Because sometimes you're just going from one patient to the next, to the next, to the next, to the next, and you don't have time to do all of the computer charting that you have to do, all the documentation. And so you might have I've known people who had to spend an hour or two per night on average to catch up, or more potentially. So you might have your 40 hours, but you might have to take it home with you. So you got to really think about that. What about a surgical PA? So what if you work with an orthopedic surgeon or a general surgeon or a spine surgeon or something? Well, surgical specialties are kind of known for working long hours. And sometimes it's going to be hard to quantify. Let me explain what I mean. So first of all, you've got however many hours you're going to spend in the clinic, like seeing the patients before or after surgery. So that can be whatever it is. Let's just say that's 30 hours or something. But then you got to consider how much time you're going to spend in the operating room. And you never really know how much time you're going to spend in the operating room, because a procedure can be scheduled for an hour but lasts 2 hours. or whatever, if there's some kind of complication and so forth. So if you're helping with the actual surgeries, that's variable. And then you might have to round on patients in the hospital, which is where you go in the morning or in the evening or something, and you kind of check on everybody who's still in the hospital after surgery, and see what they need. So that is unpredictable at times, how long that'll take as well. So if you're doing all that stuff, as you can imagine, it would be hard to even figure out how many hours you're working per week. And so it'd be really tough to figure out some kind of actual legitimate average of like how much time you're spending, how much time PAs are spending in those specialties. So surgical specialties, expect long hours. It's kind of hard to figure out. So you'd really have to look at the individual job and kind of figure that out, like in terms of what do they actually do? What are the actual demands? So, and what about other specialties? There's a bunch of other specialties. Basically, if it's like an outpatient clinic that's open Monday to Friday, think of it as being kind of similar to what I just explained for family practice. But if it's any surgical specialty, it's kind of what I just explained for surgical specialties, and that covers most of it. And then you've got things like being a hospitalist, where you're taking care of the patients in the hospital full-time. And that's a little different. That's probably similar to ER because that has the similarity where there's nights, weekends, holidays. And so a full-time schedule might be slightly less than 40 hours per week, potentially. But, a little unpredictable. So here's the thing with all those different specialties, all those different schedules, what you really got to do beforehand, if you want to actually know, is you got to not only talk to people that work in a specific company, specific clinic, but also go shadow them and see what it's really like. Because otherwise you're just not going to know. And if you really care, like how many hours you're going to be putting in and so forth, you got to do your due diligence and just kind of gather whatever information you can, go see what it's actually like, and talk to multiple people at multiple levels in the organization. And that's how you can figure that stuff out. That's what I've done when I've been looking at jobs, and it's helped a lot. So I kind of really understood what I was getting into. Or if you work somewhere where you already did a rotation as a student or something like that, that's the same idea. So what's the best specialty for work-life balance as a PA? Well, I may be biased, but I think ER is a leading candidate. And that's because if you kind of work with your scheduler and kind of figure things out, you might be able to mostly avoid nights or something where you're not flipping back and forth your schedule all the time. But then you can still do about 30-ish hours a week and call that full time, get your benefits. And so ultimately you could have quite a bit of time. So you could work like 3 days a week, maybe avoid the night shifts if you're lucky, depending on how your group handles that, and then still have quite a bit of time for family and stuff. So, and how many hours am I currently working? Well, I'm only part-time right now. So I'm only working, what would you call it? I mean, I guess like 12 hours a week or something like that, in the ER currently, because I'm doing some other stuff on the side, such as making videos for you. So, all right. So that's a little insight into how much time you might be spending working as a PA. And if you want to learn a little bit more about some advantages of being a PA over being a doctor, here's a video where I explained 5 of those. And if you want to compare being a PA to being a nurse practitioner, which is a common comparison, I've got a video right here where I break that down for you. Thanks for watching. I'll catch you next time.